The gentleman from Charlottesville, Mr. Toscano.
Thank you, Mr. Speaker. Rise for a point of personal privilege.
Gentleman may proceed.
Thank you, Mr. Speaker. Mr. Speaker, ladies and gentlemen of the House, it looks like we're having the debate right now. But there are a couple of key points that people have raised that I think require some responding to. I don't think there's any doubt. In fact, I don't think people have disputed the fact that right now we have a lot of people in Virginia who are uninsured. And I think that most people would believe that people ought to have insurance. Because if you didn't believe that, you wouldn't be signing up for your insurance. Insurance is a good thing. And I think most people would believe that health outcomes are improved by you having an access to a doctor and not having to worry about getting care if you need it. And that's why people get insurance. And I think most business people would believe and understand that the more people in the insurance pool, generally speaking, the lower the premiums. And the more younger people in the insurance pool, also the lower the premiums. There are many more people who are young in the insurance pool now than were there before the Affordable Care Act was passed. So given that we're sending this $5 million a day, given that we have all these people who are uninsured, given that we're hearing from our hospitals about their fiscal problems, where's the plan? Where's the solution? We heard a few minutes ago from the gentlewoman from Bedford. She said, there is a better solution than what the 4 or 5 plans that the Democrats have advanced over the course of our session. That's what she said. There is a better solution. What is the plan? The Speaker published an op-ed in the Freelance Star in which he said there should be an alternative approach. Where's the plan? Delegate Hugo, a few minutes asked for where are the Democratic plans that are on the calendar today. Well, I would ask you, we have a couple of Republican plans, right? Is Delegate Rust's bill the Republican plan? Is it the House Republican plan? If it is, tell us so we can debate that plan together and come up with a solution together. Is Delegate Elbow's bill the House Republican plan? If it is, let's go forward with that one. Let's have a discussion that leads us somewhere, and that starts with a plan. And we've offered a whole slew of them over the last 8 months. Delegate Lingenfelter made comment about the wisdom of ordinary Americans. Well, I think that's true. We have to respect that wisdom. So why don't we respect the fact that just in the last week, the Christopher Newport poll reports that 61% of Virginians surveyed support expansion. Sure, they're worried about some of the financing issues, as we all are. And that's why we're supporting reform as well. But they support expansion. 31% say no. But ladies and gentlemen of the House, one of the things that most concerns me about the discussion so far are the comments that were made to the effect that government programs just don't work. Now, if that's the philosophical position of this body, then why are we coming down here? I know it really isn't the philosophical position, because if government programs just don't work, we wouldn't be putting money like we do into ID and DD waivers. Government programs do work, and they help people most in need. The majority leader and I share a passion for the New York Yankees, even though we disagree on so many philosophical things. And I almost kind of chuckled a little bit when he got up and he started to talk about those government programs not working, and then the lights went out. And I thought, oh, this is interesting. But really, are we going to turn the lights out by stopping the funding of government programs that supposedly don't work? If Medicaid is broken, the argument is, let's stop it. They don't work. Let's turn the lights out on the IDD waiver folks. Let's turn the lights out on the people who have Medicaid now because they're disabled and cannot work. Let's turn the lights out on all the youngsters who need mental health funding, and the only way they get it is through a government program. Let's turn the lights out on our military and some people who are serving us as police officers who have to use the SNAP program, food stamps, a government program to help them survive. Let's turn the lights out on all these folks. That's what it means to say that government programs do not work. Ladies and gentlemen, Governor McAuliffe, several weeks ago, proposed another plan because his original plan to try to get Medicaid expansion couldn't get through the House. What did he do? He didn't just say there's a better solution and do nothing. He came up with a plan to help thousands of Virginians within the rubric of what he had to work with. We ought to have a plan to help those 400,000 Virginians. We don't see the plan. We don't know why we're here to debate something that's not real. We ask you to give us a plan. You got time to still present it today. Thank you very much, Mr. Speaker.